Good afternoon, everyone. I'm Dr. Adeoye, your usual psychiatrist on this program. Thanks so much for the feedback from the previous video. And today we'll be looking at something important. Yes, when it's mental health is always important. You remember September 10th, we celebrated World Suicide Day. And as a mental health advocate, to commemorate that, I will be talking about suicide. And so this is to send my sincere empathy and condolence to everyone who has lost anybody who died by suicide. And why should we talk about suicide? What is suicide? What are some of the warning signs we can see in someone who is about to attempt a suicide? I will be talking about all this in this video. So, the literature defines suicide as a self-injurious act that is fatal with some evidence of intent to die. So it's fatal, self-injurious, and there are evidences of intent to die. Like I said, suicide is a public health problem because World Health Organization said that as much as 700,000 people die by suicide globally every year. It is the fourth leading cause of death among young people. But there's something important that usually precedes suicide that I want to call our attention to, and that is the suicidal ideation. So suicidal ideation is like a contemplation, preoccupation, wishes about death. And this could be active or passive. So active in the sense that the person is actively planning, oh, I'm tired of life, how do I get a sniper, how do I go about this? Or as passive as, oh, I wish when I sleep today I don't wake up. And both are important because even the passive one, if it is not picked up in time and attended to, can progress to become an attempt or even an outright suicide that is completed. What are some of the risk factors that can make someone attempt a suicide? So, the commonest one we see it's common in people who have some common mental disorders, especially depression. So at times when you see that patient who has attempted suicide, all people around see oh, he has attempted to stake sniper. But when, as professionals, we get to interact with the patient, we see that even before he attempted the suicide, he's been having times where he's been unduly sad, feeling hopeless, and all that. And so it's important to pay attention to patients who are maybe currently on management or previously on management for various forms of mental disorders. In fact, I've seen a patient who had a psychotic disorder, schizophrenia, was hearing voices and had the voice tell her to drink something corrosive and she couldn't resist it. So, common mental disorders are things we should pay attention to in patients. It could put them at a risk of attempting a suicide. Apart from that, when you have patients who have gone through trauma or who have gone through stress and then finding it difficult now to cope with the stress. Like I said in one video, people who cope with stress in a maladaptive way, that is ways that are not appropriate. And this is common in students. Maybe they've been attempting an exam, and for this attempt, the expectations are so high that, oh, I'm going to pass at this particular point in time, and then seeing the results. That expectation not being met after, serial attempts can make the person just feel, oh, if I didn't make it at this point in time, I don't think I can make it again. That is another risk factor. So also people who abuse psychoactive substances like alcohol and other substance of abuse. What of people who have chronic diseases? Unexpectedly someone who has been fine having to deal with a stroke, a life event that is affecting the medical health, and it looks like, oh, since this stroke has happened now, I can't work with my right hand, I can't do anything to fend for the family. It can make the situation look hopeless, and the person feel, oh, if I can't do this again, I think it's just better I leave. And also, we know we are in an era of social media, and at times the sensationalized way that suicide is presented can also make some people want to attempt it. Some people also have access, so much access to it that at the slightest provocation, access to things to harm themselves, things like DD Fox, sniper, some of things that can easily, harm someone if you use them. So some people have access to these things at the slightest stress or provocation. If they don't have a good resilience, can make them think of doing that. And so these are some of the things that can put people at risk of attempting a suicide, trying to harm oneself. Now, there are also warning signs, and these warning signs are important because many a times people are around people who eventually attempt a suicide, they miss it, and assuming they picked it, they would have helped that person. Warning signs like when you have people who are talking of how they feel hopeless, how they feel tired of life, how they feel that they don't think there's anything to see as good again in the nearest future. These are not things you should just gloss over and say, what is happening to you? Are you the first person this will happen to? It might be a warning sign that you should pay attention to that person, that something might be loading that will be dangerous. Also, things like poor sleep, things like, having a poor appetite and anger. Withdrawal is very important, please. You just notice someone who is so outgoing. After sometimes you send message to the person, it doesn't reply, so withdrawn. And even when you attempt to reach out to the person, there's this anger and irritability. And if you are not careful, you can just give up on the person and say, what's wrong with this person? It might be that withdrawal may be a sign of help, not that leave me alone. And if you help the person at that stage, it can be life-saving. And so, finally, the list is actually endless, but some people just doing some last act as if they are preparing to die, giving out precious things, and then even writing notes or come on their WhatsApp status. And don't just gloss over some of all these things. Still reach out to them. And if you are going through any of these risk factors I mentioned, or you have people who are going through this, or you've even seen any of these warning signs in yourself or someone around you, please, the way forward, the way out is to reach out to a mental health practitioner. This is not the time to be saying you are just counseling the person. The person might need more intensive treatment than just counseling. You can imagine that woman I said who was hearing voices and then went on to obey the voice to drink that corrosive thing, or someone who is depressed. This is not time for counseling. This is time to actively treat the illness. And then when the patient is stable, you can now help out counseling and all that. And if you have not subscribed to this YouTube channel, you might be missing out on a lot of things, because mental health is something that concerns everybody. Everybody has a mental health. So I have a lot of videos that I will be uploading. We'll be talking about many more important things. Don't forget the previous video before this one, we were talking about mindset, and I still hope to continue about the mindset discussion in the next video. We just had a digression to commemorate the World Suicide Day, because this is a very, very important public health problem that we can't gloss over. So don't forget to like, to love, to share this video about suicide with someone. It can be life-saving for the person. And don't forget to subscribe to this YouTube channel so that you can also watch other videos we'll be talking about. I assure you that we have a lot of interesting topics we are going to talk about on this YouTube channel, just about your mental health. Have a lovely day. And don't forget, it's not complete, because don't forget to calm down so that you don't break down.